Beyond the routine rituals of brushing, flossing, and dental checkups, we must include oral cancer screenings, since they are an effective way to diagnose and treat oral cancer promptly. With its stealthy onset and subtle symptoms, oral cancer can evade detection until it reaches advanced stages, giving it the potential to cause devastating consequences in a person's life. In this video, we highlight the importance of oral cancer screenings, shedding light on the critical role they play in early detection, prevention, and ultimately saving lives. First, you need to understand the threat. Oral cancer encompasses a spectrum of malignancies that affect the mouth, lips, tongue, throat, and surrounding tissues. While it may not garner the same attention as other forms of cancer, its impact is profound, with significant morbidity and mortality rates worldwide. According to the American Cancer Society, an estimated 54,000 new cases of oral cavity and oropharyngeal cancer will be diagnosed in the United States alone in the coming year, with approximately 10,850 deaths attributed to these diseases. Challenges in detection of oral cancer is one of its most problematic aspects. In its early stages, oral cancer may present few, if any, noticeable symptoms, allowing it to progress undetected until it reaches more advanced and potentially incurable stages. As a result, many individuals are diagnosed with oral cancer only after it has spread to nearby lymph nodes or distant organs, significantly limiting treatment options and prognosis. Identifying oral cancer in its earliest stages, when it is most treatable, allows healthcare providers to intervene swiftly and effectively, potentially saving lives and preserving quality of life. Oral cancer screenings offer a proactive means of detecting abnormalities and suspicious lesions before they progress to malignancy. Oral cancer screenings are non-invasive examinations performed by dental and medical professionals to assess the oral cavity and surrounding tissues for signs of cancer or precancerous changes. During a screening, the provider visually inspects the lips, tongue, gums, cheeks, throat, and other oral structures, looking for any abnormalities, discolorations, or lesions that may indicate the presence of cancerous or precancerous cells. In addition to visual inspection, some screenings may incorporate additional tools or techniques to enhance detection, such as manual palpation. The provider may gently palpate, feel, the oral tissues and lymph nodes to detect any lumps, swelling, or abnormalities that may not be visible to the naked eye. Tissue biopsy. In cases where suspicious lesions are identified, a tissue biopsy may be performed to obtain a sample of the affected tissue for further evaluation under a microscope. Biopsies are the gold standard for diagnosing oral cancer. Advanced imaging. In some instances, advanced imaging modalities such as X-rays, kinetic scans, or MRI scans may be used to evaluate the extent of tumor growth and assess the involvement of nearby structures or organs. Who should undergo oral cancer screenings? Given the potential benefits of early detection, oral cancer screenings are recommended for individuals at increased risk of developing oral cancer or those with risk factors that require closer monitoring. While anyone can develop oral cancer, certain factors may increase the risk, including tobacco use. Tobacco consumption in any of its presentations, such as smoking cigarettes, cigars, pipes, or using smokeless tobacco, significantly increases the risk of oral cancer. Alcohol consumption. Excessive alcohol consumption, particularly when combined with tobacco use, further elevates the risk of oral cancer. Human papillomavirus infection. Certain strains of HPV, particularly HPV-16, have been implicated in the development of oral cancer, particularly in younger individuals. Age. The risk of oral cancer increases with age, with the majority of cases diagnosed in individuals over the age of 55. Sun exposure. Prolonged exposure to ultraviolet UV radiation from the sun or tanning beds increases the risk of lip cancer. In addition to these risk factors, individuals with a personal or family history of oral cancer or precancerous lesions, as well as those with weakened immune systems, may benefit from regular oral cancer screenings as part of their preventive care. While oral cancer screenings are invaluable tools for early detection, it's also important to be vigilant for signs and symptoms that may require further evaluation. Common signs of oral cancer include persistent sore throat or hoarseness, difficulty chewing, swallowing, or speaking, persistent ear pain, unexplained bleeding or numbness in the mouth, white or red patches on the gums, tongue, or other oral tissues, a lump or thickening in the mouth or neck, changes in the appearance or texture of oral tissues. If you experience any of these symptoms or notice any changes in your oral health that concern you, don't hesitate to seek evaluation by a healthcare professional. The benefits of early detection extend far beyond treatment outcomes. By identifying oral cancer in its earliest stages, healthcare providers can implement timely interventions to mitigate the progression of the disease and reduce the need for extensive treatments. Moreover, early detection may enhance treatment options and improve prognoses, offering hope and reassurance to individuals and their loved ones. Oral cancer screenings are essential components of preventive care, offering a proactive means of detecting abnormalities and potentially life-threatening conditions in their earliest stages. The cost of an oral cancer screening goes from $30 to $150 depending on the area you live. Most dental offices include the screening in your general dental examination, which is usually covered by dental insurance. Dentists recommend at least one annual screening, but you might need a screening every 6 months if you have any major risk factors such as smoking or HPV infection. By raising awareness about the importance of oral cancer screenings, promoting regular dental appointments, and advocating for policies and programs that support preventive care, we can empower individuals to take charge of their oral health and well-being. This is all for this video. Thanks for watching, and we hope to see you again in the next video.